Hey nursing crew! Whether you're in med-surg, ortho, or rehab, you've likely cared for someone recovering from a joint replacement. Total joint arthroplasty, especially of the hip and knee, is one of the most common and life-changing surgeries for people living with chronic joint pain. Let's walk through what you need to know before, during, and after surgery to keep your patients moving safely and confidently. Total joint arthroplasty, or TJA, involves surgically removing damaged joint surfaces, usually due to osteoarthritis, rheumatoid arthritis, or joint trauma, and replacing them with prosthetic components. Hip arthroplasty replaces the femoral head and acetabulum, while knee arthroplasty resurfaces the femur, tibia, and sometimes the patella. Patients often seek TJA for pain relief, improved mobility, and quality of life after conservative treatments like medications, injections, or physical therapy fail. Preoperative nursing care includes patient education. Discuss the procedure, anesthesia, and hospital stay. Set expectations for pain, mobility, and rehab. Teach the use of assistive devices like a walker, cane, or grabbers. Review pre-op exercises such as quad sets and glute squeezes. Stress the importance of smoking cessation, infection prevention, and medication management, like stopping anticoagulants if indicated. Pre-surgical prep involves labs, imaging, and consent. Use CHG wipes and administer pre-op antibiotics, confirm NPO status and take baseline vitals. Post-operative nursing management. Immediate post-op care, monitor for bleeding, neurovascular status, and surgical site. Pain control, PCA nerve blocks, multimodal analgesia, Foley catheter and drain monitoring if applicable. DVT prophylaxis, SCDs, early ambulation anticoagulants, prevent dislocation, especially in hip patients, no hip flexion greater than 90 degrees and use of an abduction pillow. Mobility and rehab, assist with getting out of bed to a chair on the day of surgery, coordinate with physical therapy for weight-bearing instructions. Promote the use of an incentive spirometer, coughing, and deep breathing, prevent complications. Watch for signs of infection, PEDVT, delirium, urinary retention, or orthostatic hypotension. Discharge and home care education. Educate patients on wound care and signs of infection, medication schedule and side effects. Safe home setup, remove rugs, install grab bars. Activity restrictions such as no twisting and using high chairs for hip replacements. Importance of rehab appointments and home exercises. Encourage realistic timelines, pain relief is gradual, and full recovery can take 6 to 12 weeks or longer. Bottom line, new joints need strong nursing support. Total joint replacements transform lives, but recovery requires clear guidance, compassion, and consistent care. Nurses are the steady hand walking beside patients, every step of the way. Got post-op tips or rehab hacks for joint replacement patients? Share them in the comments, like, subscribe, and follow for more ortho-focused nursing tools, grounded in practice and powered by care.